So let's go back to why we brush our teeth and what should we look for. You want to brush your teeth to alkali. So you want something that's going to be alkaline. The main ingredient to look for is baking soda. You want a food grade type of product. It's going in your mouth. You are going to consume some of it. Studies have shown that everyone consumes their toothpaste, especially children, but even adults. And they have proven, there's studies that have shown that the triglycerin, the tiny amount of triglycerin that you might have swallowed from your toothpaste, causes gut dysbiosis, which is the bacteria imbalance. So if you're brushing with triglycerin, you're brushing with that antibiotic twice a day for life and expecting to not get diarrhea of the mouth or the gut. Not going to happen. Baking soda is what I use. It's the best indicator. It's a great food grade ingredient. We bake with it, very safe, and it's alkaline. So that's what I tell people to look for. You want to restore your microbiome inside your mouth. You want to remineralize. So you want to look for something that's going to have minerals. I use hydroxyapatite. It's a brand new or a fairly new ingredient. Hydroxyapatite is calcium and phos. It's the exact identical minerals that are in your teeth. So it just makes sense to brush with it, right? I also use clay. I'll show you in a minute. I use a blend of 3 clays. Clays are amazing because they have all of the minerals, not just the calcium and phos, but they have the manganese and the silica and the magnesium and everything else, where calcium and phos are only the 2 ingredients in hydroxyapatite. So if you're brushing with something that just has hydroxyapatite and no clay in it, while you're going to be effective, as long as it has baking soda in it or something that's alkaline, you will be more effective than brushing with other things, but you're still going to not be putting in all of the minerals. And it's a lock and key. You can't, if you lose a manganese mineral out of a tooth, you cannot replace it with the calcium. It has to be replaced by manganese, and it has to be alkaline at that moment. So that's why it's important to look for something that has clay in it. And then you also want to detox your mouth. So detoxing your mouth, clay is another thing. So I always tell people, look for hydroxyapatite, clay, and baking soda. Those are the 3 main components, not glycerin. If glycerin's a part of that, forget it, not a good thing. Glycerin's going to block all of that. Clay, I love clay. This is what clay does. So I use a blend of 3 clays, but they pull toxins out of your gums. Clay binds. It's an ionic bond. And if you know anything about chemistry, if you remember your chemistry classes, and when an ionic bond forms, it is very hard to break it. This is why clay detoxes are so many people do them. They'll ingest clay. I like to ingest bentonite clay. I do it usually the 1st, 2nd, and 3rd of every month. At night, when I go to bed, food grade bentonite clay, a teaspoon in water, stir it, drink it, go to bed. When you're sleeping and it's washing through, it's going to bind to a toxin. As soon as clay binds, it does not let go, and you get rid of it when you go to the bathroom. Same thing with your gums. You're brushing for 2 minutes. As you're brushing, it's binding to toxins. You spit it out. Even if you swallow it, it's going to bind to these toxins all the way through. Any clay that you would swallow that wasn't would just clean you out as it goes out. So that's why clay, as long as it's a food grade, I use food grade clay in my products. Most dental products don't use food grade clay when they're using clay. Second, it removes stains off the teeth. So it's going to actually whiten and cleanse the teeth as well. It neutralizes acids because clay is actually slightly alkaline. Adding baking soda to it actually makes it more alkaline, and then it can be more effective against all the acids inside the mouth. And then it also puts the minerals back in the teeth because it's mineral rich. The blend of 3 clays that I use, bentonite, white kaolin, and French green. Bentonite, and you'll see bentonite, that's the most common clay in tooth powders and toothpaste. Bentonite's great. Not all inclusive. So I blend it with kaolin, which has some of the minerals that bentonite doesn't. French green is because I'm a nurse anesthetist, and I know that if I can reduce pain and inflammation in my patients, I can speed healing. That's been proven. Reduce pain, reduce inflammation, healing happens so much faster. Same thing inside the mouth. French green is anti-inflammatory, and it's analgesic by nature. So if you're having any issues inside your mouth, it's a great medium to brush with. French green clay is from the French sea. So it's green because it has plant breakdown, it has phytonutrients from LJ and other plants. So when you think about all of those, like LJ, how many nutrients and vitamins are in LJ, as you're brushing those into your gum tissue. Mouthwash. I'll dive into mouthwash for a second. Mouthwash is typically, I tell people avoid mouthwash unless you know exactly what you're looking at, because most mouthwashes do more harm than good. Most mouthwashes, including some natural mouthwashes, are destroying all your good bacteria inside your mouth. So you really don't need a mouthwash. If you're brushing with the right thing, the best thing that you can follow it up with is a serum, which would be an oil-based serum. Oil is what passes through and carries things through into the tissue. We call it lipid soluble. Things have to be lipid soluble, not water soluble. Most mouthwashes are made with water as a base and alcohol. Nothing is going to actually cleanse the tissues of your gums. It's actually just going to super clean, overkill your mouth. It's going to sterilize it. Think about cleaning and sterilizing an OR room. You're getting rid of all the germs. Well, that's what mouthwash does. What you really want is something that's going to penetrate and nourish the tissues of the gum. If you want to grow back your gums, if you want to establish healthy gums, you want to nourish it. So olive oil is what I use in my gum serum. It's a base. Many people do oil pulling. Oil pulling, I always get asked, what do you think about oil pulling? And I always like to tell them that, the reasons that people oil pull, and most people use coconut oil because it tastes the best out of all the oils. You have to swish coconut oil, olive oil, castor oil. Those are usually the oils that are used. You put a scoop in your mouth and you have to vigorously swish it for 20 minutes. People cut it short. They don't do it all. That pain point is I got to do it for 20 minutes. I have to swish vigorously. So you have to pay attention. And it's just, it's not conducive to most people doing it for 20 minutes and correctly. Although it works great. It helps to cleanse the tissues, helps to whiten the teeth, support healthy microbiome. At the end, you spit it in the garbage can and it's gone. But what's interesting is if you change what you're brushing with to a clay-based toothpaste or tooth powder, clay detoxes. Remember when I talked about detoxing? Clay detoxes very quickly. And so in a 2-minute brush, you are effectively going to do what oil pulling does in 20 minutes. You just brush, you're good. So not saying don't oil pull. If you love it, do it. It's still great. But if it's a pain point and you want the same effectiveness in a 2-minute brush, changing what you brush with will do the exact same thing. My gum serum is an olive oil base. Olive oil is actually the best medium to use for cleansing your tissues of your mouth. The reason people don't use it to do the 20 minutes is because it just doesn't taste good. If you've ever swallowed olive oil, I've done a gallbladder cleanse where you drink like a cup of olive oil. It's horrible. Like on pasta, it tastes great with seasoning, but by itself, it's not good. So my gum serum has olive oil because it's nourishing. It helps support the tissues of the mouth. It helps support the collagen. Collagen is extremely important when you talk about bone health, the bone, your jaw bones, but it's also important for gum tissue health. It also has nutrients that's going to increase blood flow and support the microbiome. But I blend it with 11 different essential oils. The essential oils are imperative because they help reduce inflammation. They help increase healing, increase blood flow, support the microbiome, penetrate the tissues so that they can actually get into the pockets of the gum or get into where the bacteria or everything might be hiding, helps fight gum disease, prevents tooth decay, and then ultimately will help ward off any bad breath that's going to freshen your breath. And then this is the light therapy that we mentioned. I really wanted to create something that was going to help the mouth heal or stay healthy if you're someone who has a healthy mouth. I also wanted something that was going to be able to whiten the teeth, but whiten it differently. When I mentioned peroxide and how it destroys the internal infrastructure of the tooth to whiten it, I wanted to do something that would actually help whiten the tooth by remineralizing the tooth, making that enamel thicker and thicker and thicker. But I also wanted to address the bacteria inside the mouth, and I wanted to address the gum tissue. So I developed a teeth whitening system that does more than just whiten your teeth, because it uses both the red and blue LED lights. So using the system, you can use, it has 16 red lights, 16 blue lights, and you can use them independently, all red, all blue, or you can use them together and have 32 lights. The red light therapy supports health. I usually tell people the red goes with your gum tissue red. So red. If you have issues with your gums, receding, bleeding, sensitivity, anything, red light therapy is what I would suggest you do. Use the red light only. It's a 15-minute treatment. You can use it every single day. You can use it with the gum serum. You can use it with my gel, but it's important to use the red light. It's going to reduce the inflammation. It's going to increase blood flow, and it's going to increase collagen. This is the device that helped somebody heal their gum tissue within 3 months on their path to no longer needing any kind of gum transplant or what for gum therapy. The blue light supports bacteria. I always say B&B, blue light bacteria. If you have a bacteria problem, if you have cavities or sensitive teeth, if you have gum issues because of bacteria, the blue light is what's going to help support that. What's interesting about blue light, Harvard did a study, and what they exposed the bacteria that causes cavities. There's a bunch of different ones, but they all have this black, like a mitochondrial black portion to it. And what they discovered is when this black piece of bacteria is exposed to blue light, it essentially erupts. It actually makes that black mitochondria piece explode. When that happens, the bacteria is dead. So in essence, blue light at a certain nanometer, which is what ours is set at, kills bacteria that causes cavities. So imagine putting this inside your mouth. Blue light, just like red light, penetrates into the tissues, can get between the teeth or into the pockets to help get bacteria that you can't get when you're brushing or you can't get when you're flossing. So it's going to penetrate the tissue, kill the bacteria, and freshen your breath. So I tell people, when you have a bacteria problem, do only the blue light. If you have a bacteria and a gum tissue problem, alternate. Or you can do both treatments independently. So you can stack them and do a red in the morning, a blue at night, or you can do them back to back if you want. But I usually say do the single light. Or you can alternate days. If you just want to do one treatment a day, do one red one day, blue the next, red, then blue. What's the time to do them when the 32 lights, the blue and the red at the same time, is typically when you don't have any issues, when your mouth is super healthy. You're going to get the effects of both, but because you're getting both, you're going to get a little bit less of the high potency red, high potency blue. So when your mouth is healthy, if you don't have any issues going on at all, that's when I say do the red and blue light. And then ultimately it's going to help whiten the teeth, because the bacteria that causes cavities and gum disease is yellow. It's kind of like a yellowish color. When you see it, plaque is like a yellowish color. If it's killing this bacteria, it's going to kill that bluish or that yellowish color. And it's going to actually whiten your teeth that way. But it's also connected to using the gels. My gels that I created are peroxide free. I made them with olive oil as the base. So for the same reasons, nutrients, it's alkaline. It's going to help with the gum tissue. Made with hydroxyapatite. If you're going to have this gel on your teeth for 15 minutes, think of how much calcium and phos can go back into those teeth and remineralize, build that enamel to make them whiter. Has 2 different clays for the exact same reason. These are all alkaline. And then it has the essential oils that are going to help with the bacteria, going to help increase blood flow, and all of the other things that are really good. This is not going to hurt. So it's not, doesn't have peroxide. There's nothing in this that's going to cause your teeth to hurt or be sensitive while you're using this. In fact, the opposite is true. This is what my products look like for anybody that's interested. I did create a kit. It's called the Detox Kit of my dental products. It's a 60-day supply. This is like, people kept asking me, where do I start? What do we use? So I put this together. You get a morning and nighttime tooth powder. The powder is different, of course, than using paste if you've never used powder. It's more concentrated, which is why I like it to start. I do make a paste, and you can convert to paste after your 60 days if you want. I'll tell you the honest truth is that most people, once they switch to powder, they never go back to paste. The powder is paste without the water. So when you think about extracting the water, you're left with all the good ingredients. My paste is made with colloidal silver. So the colloidal silver makes it a little bit more of an active. It's going to help get rid of the bacteria and reset the mouth. But typically toothpaste is made with just regular tap water, crap water, loaded with those heavy metals you're trying to get rid of. So using a powder is going to help detox your mouth. And then you get a morning and nighttime. You get a copper tongue scraper. We didn't even talk about that, or I didn't go into that, but scraping your tongue helps to remove that bacteria coating on your tongue. And scraping takes about 10 seconds, not even, twice a day. So scraping your tongue, copper tongue scraper will last you a lifetime if you take care of it. You get a little bottle of my gum serum that'll last about 2 months as well. You can take that with you. You can use it during the day. But that's 1 or 2 drops on your finger, 3 if you want, and then just swipe it all over your gums and then around the tissues of your mouth. And the floss picks that I make are biodegradable. They're made from cornstarch. The entire pick biodegrades. And then the floss is bamboo infused with charcoal. And then the toothbrush is a bamboo toothbrush, biodegradable bamboo toothbrush, as well as a detoxing deodorant, because most people that I've talked to have tried numerous deodorants, wasted so much money that, that's the biggest pain point. I've wasted so much money on deodorants that mine is developed by a nurse, as a nurse who wants to deep cleanse your tissues. So it's created completely different. So I gift you one for free with this kit so that you don't have to waste any money. If it works, great. If it doesn't, you didn't waste any money. And then the teeth whitening system is pictured there as well. Let me just really quick, and then I should have time for questions. Tips for a healthy mouth. My kids always come back to tell me the first one: eat your dessert first. They're like, we go to dinner and they're like, Mom, I want to order dessert. You always say eat it first. And the reason I say eat your dessert first is because it's usually loaded with sugar. And if you're going to eat sugar, eat it at the beginning of the meal, because then at least you can wash it off your teeth and you're not going to feed the bacteria as much. It's going to go feed the bacteria in your gut, but at least your mouth can stay as healthy as possible. So eat your dessert first. Eat your greens last. Eat your crunchy food or greens last as you're eating it. Even if you just saved one bite, eat your steak, eat your potatoes, eat whatever. Save one bite of your vegetables, because that, just eating that at the end is going to help get rid of the rest of the food in your mouth and swallow it down so that it's not there lasting. Eat crunchy snacks like your carrots and celery and broccoli and things like that. Crunchy snacks, that's going to help clean your teeth throughout the day. Swish with water after meals, snacks, and even coffee or tea. Just a brisk swish. Grab your water. When you're done eating, swish it really good between your teeth. That's going to help cut down on the amount of food that stays inside your mouth and get rid of like that excess sugar or anything. I always say finger brush. I've got the little size that comes in the kit of my Dirty Mouth tooth powder. And I tell people, dip your finger and just finger brush that right on your teeth. You can, let it wear away and swallow it because it's all food grade. And I do that. And that's what I use to freshen my mouth. And, you're remineralizing your teeth and you're getting rid of that acid. So that's the important part. And then freshen your breath throughout the day. The gum serum is great to do that. Just a little drop, and then you can drop it on your tongue, kind of put it in some water. You can also drop it in water and swish it around in your mouth, or just right on your gum tissue. I just want to go over the alkaline foods. These are the things you want to end with. Keep some of it towards the end of your meals. But the highly alkaline, of course, is your broccoli and your cucumbers and green drinks, kale, kelp, spinach, and parsley. Those are the main ones that you'd want to end with if those are your choices. But any of these are great. any of these are great. And, obviously it's mostly your vegetables. I just wanted to put this in here. I thought this was extremely interesting, especially when you guys are all gluten-free, which I am as well. Consuming gluten, this is what the general public doesn't quite understand. Consuming gluten blocks the absorption of certain essential vitamins and minerals. One of them is vitamin D, which is extremely important for the development and strength of your tooth enamel. So if you're not able to absorb vitamin D from your food, this is where I'm talking about, even if you don't have digestive issues and you're eating gluten, you're not even absorbing your nutrients because gluten is blocking them. And then you become deficient internally, and then your saliva becomes deficient, as well as all the other organs become deficient because gluten is actually blocking the absorption of minerals and vitamins. So there you have it. The oralgasm, the fresh feeling inside your mouth when your bacteria is healthy. So who's ready to start having oralgasms? And that's just me and my family again, keeping you healthy as your natural nurse.
Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.